So thank you, Bahar, and thank you to all the presenters beforehand. What a hard act to follow in some senses. Um, it is been a very interesting morning. Lots of learnings, lots of very positive focus on having a really thoughtful and thorough discussion around refugees. I want to begin. I know we did a land acknowledgement at the beginning, but I think it's important to acknowledge that the land on which Mahi and I are presenting is the unceded traditional territories of the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations. John is presenting today from the area known as Toronto, which has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nations, Inuit, and Métis communities, and we acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant and agreement to peacefully share and care for the Great Lakes region. In gathering today, each of us expresses gratitude for the ability to live, work, and learn on these lands. Today, we're going to follow up and present initial findings into the employment and income trends among Syrian refugee families in British Columbia. After briefly introducing our project, I'm going to turn this over to my colleagues Mahi and John, who will present on data collection in BC, followed by John with some of the initial insights and preliminary themes, specifically focused on employment and income security. This work represents the first step towards a broader report on the longitudinal integration and settlement of Syrian refugee families in BC. What a year 2015 was. We saw the beginning of Operation Syrian Refugee, and over the coming months, over 44,000 Syrian refugees were resettled to Canada. Of those, 3,200 settled here in British Columbia. In early 2016, Drs. Michaela Hinya and Quam McKenzie received funding from the Canadian Institute of Health Research to lead a project called the Syrian Refugee Long-Term Health Project, or what we affectionately call SyRIA.lth. It's a mixed methods, community-based longitudinal analysis of Syrian refugee families settled in 3 provinces. In British Columbia, focused on the Thompson-Okanagan region and Metro Vancouver, on Ontario, in Kitchener, Toronto, and Windsor, and in Quebec, we had participants in Montreal. Our co-investigators and research assistants represent a diverse array of backgrounds from the medical professions to social sciences. We're based in academic organizations, in community and settlement agencies. The overarching goal of the SyRIA.lth project itself is to improve the health and well-being of new Canadians by understanding some of the factors contributing to successful integration outcomes, so that we can begin to tailor and adjust resettlement programs to best suit newcomers' needs and circumstances. The project is a 4-year project. We interviewed individuals once per year, usually in the spring, across all of the provinces. All interviews were conducted in first language by individuals who spoke Arabic, and we adjusted those and we complemented those with some focus groups in year 2. The focus, as you'll see from Jonathan, is of our questions really ran an array from looking at the demographics of the population that were participating, to open-ended questions about where people were from, their backgrounds, when they arrived, the category of entry. So we interviewed individuals who arrived as privately sponsored refugees, as government-assisted refugees, and some who in a much smaller group who arrived as blended visa office referred refugees. We also drew upon standardized tests from particularly things like the Harvard science, the Harvard, and the brain stops, from the Harvard survey, as well as looking at things like employment, sense of belonging, and trauma. In total, we interviewed 1,992 individuals across the provinces, and this represented 856 households. The findings presented today focus on a very small aspect of our survey, looking at employment and household incomes of those individuals who were interviewed in years 1 to 3. We've recently completed the year 4 data collection, but it's in the process of being cleaned. And due to the impact of COVID-19, we wanted to make sure that before we start presenting on it, that we had had time to thoroughly analyze that. I'm going to turn it over now to Mahi, who's going to talk about the data collection in BC specifically.
Thanks, Kathy. So I'm Mahi, and for the last 4 years, I've been coordinating the project in BC. It has been a very interesting experience and a very rewarding experience. To start off, just in terms of recruitment of participant, in 2016, ISS was very well placed to be able to reach out to government-assisted refugees, as well as refugees who came as under the blended visa office criteria. So we were able to send out basically a mass text message to participants and invite them to join the survey. For the privately sponsored refugees, which also had to be included as part of the sample, it was a little bit more difficult. So we used kind of a snowballing technique where we started off with a few who referred us to more of this criteria. We tried to diversify the sample. We knew we were going to focus on Metro Vancouver and the Okanagan region. So within Metro Vancouver, we spread out to cover Syrian participants, or Syrian refugee participants in Vancouver and Richmond and Surrey, Burnaby, New Westminster, and Langley. And in Okanagan, we also tried to branch out to besides Kelowna, to Summerland, Peachland, and Kamloops also. We try to also cover families, single refugee units, as well as to be as much as possible inclusive of Syrian refugees of different and diverse ethnic backgrounds represented in the Syrian population in Syria. So at some point towards the end, we realized, oh, we need to make sure that, we have, for instance, Armenian Syrian refugees included in the study. So we went out and tried to find more of these groups, just to make sure that we are being as inclusive and as representative as possible of Syrian refugees who were resettled in Canada. In terms of the data collection process itself, we were working very closely with our national partners and the kind of central coordinators at York University. We had to recruit a research assistants, a team of research assistants, basically, to be able to administer the survey face-to-face with clients. We were trained by the national partners on the kind of the data collection process, and research assistants were provided regular support on almost like a weekly basis to make sure that all research assistants are conducting the research in the same way and getting the same support. For the first 3 years, we did face-to-face interviews. We would, research assistants would basically book appointments with participants and go to their homes and administer the survey. Given COVID-19 and the situation of COVID-19 last year, we were not able to do that. So we resorted to phone interviews for year 4. Basically, it was a very interesting process to try and maintain keep kind of a retention of the participants as high as possible. We needed to be creative. We needed to continue to engage the participants throughout the year. So we would send them kind of regular, an annual update of where the project is at. When the research assistants were kind of stayed with us over the years, they also built quite a rapport and a trust relationship with the participants. It involved quite a bit of explaining what the project is about, explaining that how the study results will impact them, and also just making them feel comfortable and confident to speak and share their experiences with us. Assuring them that any information that they share with us is confidential, assuring them that they can opt out of the study at any time, and obviously providing a remuneration for their time to show appreciation for their time. Overall, we had a very good retention rate of participants. Only 14% of participants dropped out in Vancouver, in the Metro Vancouver area. And it's mainly due to either they're moving to another province, or they're getting busy with work, or some of them, their health situation got a little bit harder. In Okanagan, we had a really good retention rate. We only had one person drop out of the study in the 4 years. I guess to just give you a sense of some of the challenges that took place during data collection, the nature of the questions asked, some of them could be a little bit triggering because they kind of probed around people's mental health. So we had to be prepared. We prepared some resources that research assistants had on them that they were able to share with participants in case they felt a need to reach out to other service providers to help them deal with any trauma issues that they might be feeling. Additionally, just trying to keep research assistants are usually young students who are interested in the subject area we're doing the research on. So a lot of times, some of them had to move on. So we had to just train new participants, and also just make sure that we work in teams of researchers who have been with the project longer. One of the main kind of challenges that we faced is a lot of the participants live in small kind of living environments. So when we would go in to interview, let's say a husband and wife, sometimes we would be challenged into that they kind of wanted to answer on each other's behalf. So we then devised this process where we would only work in teams and go to homes in teams. So interviews would be done separately for the husband and wife simultaneously at the same time, and that kind of dealt with that situation. Generally speaking, also, I think the main challenge also from a project kind of coordination perspective is just to also ensure that our research assistants are well taken care of. And it was great to have the support from, to be part of a national team that was kind of with research assistants all over Canada, kind of doing the same work. So we've organized some kind of self-care trainings for our research assistants throughout the lifetime of the project. So these are some of the issues that kind of came up and how we've dealt with them. I'll hand it over on to John, who will talk to us in more details about the findings relating to employment. John, I'll hand it over to you.
Sure. Thank you very much, Mahi. Thank you, Kathy. Thank you for everyone for being here today, for hearing our talk. So the SyRIA.lth project, it was a 4-year longitudinal study taking place across Canada. As Kathy was mentioning, we are looking at Ontario data, Quebec data, and British Columbia data today we're just really just going to focus on what was going on in BC. So across all 4 years, we were measuring a whole slew of questions, looking at things such as employment, housing, accessing healthcare, accessing education, and there was an overarching goal that we would look at changes in physical and mental health over time. Of course, in year 4 with the COVID pandemic, we had to drastically change the questions that took place during that time in the survey, and we're still in the process of cleaning that data right now. So this presentation is just going to really focus on years 1, 2, and 3. So we're going to be focusing on a total of 273 individuals, and we're going to be looking at employment and sources of income. Okay, so we broke up this preliminary analysis in 2 ways. We wanted to look at the individual level, and then we wanted to look at the household level. The idea here is some of the questions in the survey are very geared specifically towards the individual, such as, are you currently working, rates of employment, how many jobs are you working, etc. But then other questions in the survey were more specifically geared towards the household, such as, what sources of income come into your household, how many individuals are in your household, etc. So that's how the analysis is going to be broken up. We're going to first focus on